57% on that. The chairman's right. I would fall into that category where I do not use the VA hospital for healthcare services, but you use them for others. And your question about what they do well is, in many cases, you do have some of the highest quality care being delivered. And I've often said those, you can have that, the best physician in the world, but if there's an inept administrator, they're not going to get the patient to them or be able to care for them. So there's part of that. As far as the mental health piece on this, is that I do think, and this is again, I want to keep coming back to this, as a country in general, mental health parity is something we're still struggling with. And so the problems that are in the military are also manifested themselves in the private sector. The VA is moving forward on this, and I'm proud just recently, the chairman and I together did the Clay Hunt Suicide Act that started to take some of the new best practices, and that was a clear-cut piece. If you're going to get into the privatization piece, one of the best practices piece shows that if you can get peer counseling and peer work as early as possible with some of these folks, you reduce the significance of a suicide or an attempted suicide. And that would be a case of, that's just smart. That's just smart to get them back in their community, because if they have to travel to Minneapolis and they live in southern Minnesota, they're disrupted from their community. It's disjointed from that. They would be better off to get it at home. So I think overall, they're starting to lead on many of these things, as the VA always has done. But again, they're not going to do it alone, and there are those barriers that make it very difficult for some of the practitioners to deliver that. But I think, again, trying to compare them, that old, we know it's an overused cliche, but if you've been to one VA hospital, you've been to one VA hospital, but there's truth in that. Some are better than others, and some are administered better than others, and I think in that lies some solutions on looking at how some of them are doing it right, and some of them are quite honestly failing. But I think overall, they, compared to patient care in the private sector, they stack up pretty well. And again, I think the chairman would say this, and he always has, if you can get in, and if you can get by the barriers, which is a fair point.
The surveys are fairly good for those who are in and getting physical treatment, right? As the level of happiness or satisfaction is roughly comparable to what we see elsewhere. I just have two more questions, and then we'll go to all of you.